Well, today we're going to talk about Botox. It's been around now for about, 15 plus years. There have been about 11 million safe injections or treatments with Botox. And basically, it's a neurotoxin. It's a material that in large quantities can be toxic. It comes from a bacteria, and it has been lethal when used in large doses. But like any other medicine, if it's used in the correct doses, it's completely safe. And the dosing that we usually use when we treat muscles in the facial expression areas is so low compared to what is needed to produce some type of systemic damage that it's really considered to be completely safe. But what Botox is, again, as I mentioned, a neurotoxin that basically stops uh, muscles from working because it blocks the interface, the stimulation of nerves that go into the muscles that make the muscles contract. The muscles contract. When they do, they cause creasing of the skin, which we call wrinkling, and then if that happens for many, many years, the skin will permanently crease, much like a piece of cardboard that you bend 1,000 times, and then when you look at the cardboard, of course, there is a permanent crease in the cardboard. This is basically what's happening with your skin as we age. Botox is, as I mentioned, a botulism toxin, a derivative of a botulism toxin that is quantitative and qualitatively assayed in the lab, so we know exactly how much we're given. But as such, it's a toxin because it blocks a natural function, and that natural function is blocking the nerve stimulation into muscles where we put it. And that's one of the keys. It's not a systemic reaction, so it's only reactive exactly where we inject it. Botox is the most commonly used in the upper half of the face. And by that I mean the frown lines and the horizontal forehead lines and also the smile lines. Those are the big three, if you will. Probably 80+% of our treatments are along those areas. We can also specifically use it in special cases to help elevate the brows, to stop the bunny lines on the sides of the nose, to stop the intensity or the depth of these vertical creases here in the upper lip, and also to relax the muscles here that help to pull down on the corner of the mouth. It also can be used when you have these little fibrillations, muscle fibrillations on the chin, and also in the neck area to help smooth those bands that we see as we get older. Also, those are called anterior platysmal bands, and they can be softened with uses of Botox. Well, it's injected in the office with a very, very small 32 gauge needle, which people hardly feel, but again, it is a needle, so there may be a minor little prick, which can be, if it's bothersome to the patient, completely anesthetized just by putting a little ice cube, for instance, or a cold spray on your skin for a couple of seconds, and then you wouldn't even feel that. But the needle goes in and out just like that, and the Botox is deposited. So pain factor is practically nil. You're able to leave right after the treatment because of the fact we use such concentrated volumes that you're not swollen, and consequently you can go back to normal activity. Now it's said that you ought to wait perhaps 2 to 3 hours before you lay down in bed or you do floor exercises, possibly because laying down, putting your head in a dependent position, can help spread the Botox into muscles or areas that we don't want it to go. However, this is extremely rare, and because of the fact that we're using such small volumes now, you don't have a lot of volume in your tissues to spread out. So consequently, we tell our patients the only thing we really want them to do is to use those muscles, frown, elevate their forehead, squinch for about a half an hour after we inject it. Why? Because we feel that helps the Botox get absorbed more effectively into the muscle mass.